Hi, my name is Hannah Dykes, and I am from Henderson State University. I'm currently a senior from Henderson, and I plan on graduating in May of 2021. My major is integrated studies with focus areas in biology and psychology, and the research that I chose to do was over obsessive compulsive disorder, or better known as OCD. I chose to do this research because I have had very personal experiences with OCD and would really like a better understanding of it. So what exactly is OCD? OCD is characterized by having compulsions and or obsessions, and compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession. And an obsession are reoccurring and persistent thoughts, urges, or images that are intrusive and unwanted. So obsessive compulsive disorder is an anxiety disorder, and so these obsessions or compulsions are performed in order to relieve that anxiety or stress to not performing them. So there are four main types of OCD. These are the contaminants, the perfectionist, the doubt and harm, and the forbidden thoughts. So the first, the contamination, is what most people would think if you heard OCD. So the germaphobe or the neat freak and all of that, the clean freak, people that are scared of germs pretty much. So this type will result in excessive washing of the hands. They clean their spaces constantly. They have frequent clothing changes, and etc. There's way more. And then they do this in order to relieve the anxiety that they have from being exposed to germs or contaminants. And then the next type, which is the perfectionist, this is another like stereotypical OCD. So these are the people that like to arrange things specifically. They like symmetry. They will organize their closets they will color coordinate their closets. They color coordinate everything, organize everything in a way that feels even to them and symmetrical. And then the next is the doubt and harm type. These people are obsessed with locking and relocking doors. They have a specific fear, which in this scenario would be a burglar coming in or someone breaking into their home. And so they are obsessed with making sure that their door is locked, and so they do this by unlocking it and relocking it to make sure that it locked right. And then the last type is the forbidden thoughts. These people have, their common thoughts are either sexual, religious, or violent thoughts, and these people have to constantly worry about if they are going to actually act on these thoughts or not. And although all of these types are very different, most OCD cases come along with a specific number. So they're obsessed with numbers. It's very easy to become obsessed with numbers. And so say your perfect number is 3, then whatever your compulsion or obsession is, then you will do it 3 times. So let's use the locking the doors example. You will unlock and lock the door again 3 different times. And so that is a normal behavior of people with OCD. So the diagnosis, how do you become diagnosed with OCD? So according to Everyday Health, people are normally diagnosed between the ages of 10 to 12 and 18 to 25. About 2.3% of the United States has been diagnosed or will be diagnosed with OCD, and it affects men and women very equally. So there's no effect on different genders. And then, so in order to diagnose someone with OCD, you have to have 3 things done. You have to have a psychological exam. You have to have the criteria for, or follow the criteria for the DSM-5 for OCD. And then you have to have a physical exam performed. And so the psychological exam will just be you going over your triggers, your symptoms, your thoughts, your feelings, all of that, just kind of discussing with someone how you're feeling and why you feel that way and what triggers those actions. And then the criteria for OCD from the DSM-5 is actually you have to have the presence of compulsions or obsessions or both. You can have one or the other or both of them together. The next, these have to be time consuming. So they have to take up at least 1 hour per day. And then they have to cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. And then the symptoms cannot be related to drugs or any other mental disorder, and they can also not be better described or explained by any other mental disorder within the DSM-5. And then the last thing, you have to have the symptoms occurring for at least 2 successive weeks. And then with the physical exam, this is just performed to make sure that there is no other possible reason or explanation that could be causing your symptoms, and such as drugs or anything else. Okay, so although OCD is not curable, there are many things medically or medicine or therapy that can help calm your symptoms down or relieve some sort of anxiety from this. And so starting off with the medicines, there are 3 main medicines used, and these are SSRIs, anxiolytics, and antidepressants. SSRIs are used to ease symptoms of depression and anxiety. Anxiolytics ease symptoms of depression and tension and anxiety while promoting sleep as well. And then with the antidepressants, these are used to relieve symptoms of depression and certain anxiety disorders. Then there are also 4 types of therapies, and these are the aversion therapy, cognitive behavioral therapy, psychotherapy, and systematic desensitization. So starting off with cognitive behavioral therapy, it's used to modify negative thoughts and behaviors associated with psychological distress. Aversion therapy is associating the unwanted behavior with a negative experience or a negative reaction. Psychotherapy is more of the treatment of mental disorders through talk and discussion about these disorders. And then systematic desensitization is when you start to gradually expose your clients to their fears in order to relieve their stress eventually. So this is just a slide to show a show that I found on Netflix actually, and all the people on the show have a wide range of anxiety disorders, from anxiety to depression to OCD and even further on. And so the one episode that caught my attention was over a guy named Paul, and he actually had the doubt/harm type of OCD, and he was obsessed with house fires. So he was concerned that his stove was going to, throughout the night or in the middle of the day, if he wasn't paying attention, cause a house fire, and that he was not going to get his family out. He wasn't going to be able to escape. And this started taking a lot of time away from his sleep. So his sleep schedule was really crazy. He wasn't able to sleep at night. He would rarely go sit down. He wanted to pace the kitchen and make sure that his stove was not going to just explode any second. He was really having problems with this. And so this TV show brought in therapists who use systematic desensitization on him. And so they gradually exposed him to his fears. So, for example, they would have him stand by the stove while it was turned on for like 4 minutes, 5 minutes, and as long as he could go, different days. They would increase his time from sitting there to show him that his fears were not going to happen normally. So they wanted him to see that nothing was going to happen badly if he did not turn the stove off and off and on and off and on all the time. And so they also would take recordings and try to keep him in his room to see if he could last all night and stay in there all night without checking the stove. And they just gradually tried to help him relieve these fears and anxiety. So my mentor her name is Robin Campbell. She is currently working at Washita Behavioral Therapy in Arkadelphia, Arkansas, and she is currently a qualified behavioral health paraprofessional, but she is getting her master's and is actually one semester away from getting her master's. She is graduating from Henderson State University in 2021 along with me. And in my discussions with her, we discussed the just overall symptoms of OCD and how to tell if someone has OCD, or just kind of things that they will put off if they're not aware that they have it. And she actually gave me the access to the DSM-5 so that I could find the definition that I used previously. We talked about the compulsions or obsessions that she has seen before in clients, and we also talked about how she would treat a client if they had came in with an obsession or compulsion. And so what she said that she would do would be to start off with medication. She would start with SSRIs because unless they have a depression associated with it, or that they've had depression in the past before, she said that she would start with SSRIs and move forward from there with the other medications if this one did not work. And then she also said for the therapies that she would use a combination of cognitive behavioral therapy and psychotherapy in order to discuss with her clients their type of compulsions or obsessions and see what they could do by relieving this anxiety from her clients. And she said that depending on what type of OCD that they had, then she would move forward with the other type of therapies. And then this is my reference page. And that is all. Thank you.